A urinary tract infection, or otherwise known as a UTI, is an infection in any part of your urinary system. Your kidneys, ureters, bladder, and urethra. But most infections involve the lower urinary tract, which is the bladder and the urethra. I wanted to make this video sharing with you my top 7 tips I have for preventing urinary tract infections, so stay tuned until the end. Women are at a greater risk for developing a UTI than men. In fact, around 50 to 60% of women will experience a UTI in their lifetime, and recurrences usually occur within 3 months of the original infection. 80% of returning UTIs are reinfections. Not all of them can be avoided, but hopefully with these tips I'm sharing with you guys, those numbers will go down. So before we begin, let's look at some symptoms first. So some UTIs won't cause any symptoms, but when they do, it'll be a strong persistent urge to urinate, a burning sensation when you do go pee, a cloudy pee that may look red, bright pink, or cola colored with a strong smell, and oftentimes pelvic pain associated with that. They happen for a number of different reasons. For example, when urine pools in the bladder, making the perfect spot for bacteria to grow, the pooling may be caused by something blocking the flow of pee to the urethra. Let's say an enlarged prostate in a man or a distended bladder in a woman. They can also happen if bad bacteria simply cling to the urethra and find their way to the bladder. Things like sexual activity, having multiple partners, catheters, kidney stones, and a lack of estrogen in the lining of the vagina all play a part too. So the first tip I have, and things that you can start doing right now to prevent them, is wipe from front to back. The rectum is a main source of E. coli, so when you perform a number 2, wipe from front to back, as this decreases the risk of bringing E. coli from back to front. It's even more important that you do all of this, especially if you have diarrhea. So always keep in mind clean hygiene practices. This applies to men too. The second tip, drink plenty of fluids and stay hydrated throughout the day. This will make you pee more frequently, which flushes bacteria out of the urinary tract. Also, remember to limit or avoid alcohol and caffeinated drinks as much as possible, as these can all irritate the bladder. The third tip, avoid holding in your pee. If you have to go, respond to nature.
Isn't it amazing, Brian? You can see for... Oh, you're doing your pee thing, right. I don't really know what the point is. I mean, there's no way other dogs can smell this.
Trust me, Stewie, they'll know.
Try not to wait more than 3 to 4 hours to pee, and when you do pee, try to completely empty out your bladder each time you go. This is even more important if you are pregnant, as pregnancy puts you at an increased risk for UTIs. The fourth tip, urinate before and after sex. Sexual activity increases the chances of getting a UTI, especially if you're a woman. That's because bacteria can easily get into the urethra during sex. The fifth tip, avoid scented products. The vagina naturally contains more than 50 different microbes, many of them which are called lactobacilli. They help keep the vagina healthy and the pH level balanced. Scented feminine products can disrupt this balance, giving bacteria a great place to grow. So avoid douches, that's also life advice. Avoid scented pads and tampons that are scented, basically anything scented down there as well. The sixth tip, look at alternative birth control options. Some types of birth controls promote an overgrowth of bacteria. These include diaphragms, spermicides, and spermicidal condoms. The seventh tip, although scientific results are conflicting and some pharmacists won't recommend this at all, is the use of cranberries and cranberry juices. The berry has compounds called proanthocyanidins that may prevent E. coli from sticking onto the urinary tract tissues. Some studies show it reduces the frequency of UTIs and other studies don't, so it still remains a low-risk remedy that you could try in its extract form, which are low in sugar, or any unsweetened cranberry juices if you'd like to give it a shot. If you think you might have a UTI, call your doctor at the first signs and symptoms. The sooner you can catch a UTI, the better. In some post-menopausal women, a healthcare provider may suggest an estrogen-containing vaginal cream too. So this is why it's best to communicate with them when you have a UTI, especially if you have a fever alongside that with nausea and vomiting. They'll take a urine sample to find out what's going on, to confirm, and then treatment will most likely require an antibiotic. A bonus tip I like to just add in is avoid tight-fitting clothing. This can actually do you wonders, like help keep you dry better, prevent bacteria from growing in the urinary tract. Wearing cotton underwear can also help too, as this will help prevent extra moisture from getting trapped around the urethra. Just thought I might add that in. Anyways guys, like this video now if you found it useful or helpful in any way. I'm hoping it can at least benefit at least one of you guys, even to my men out there too, since you guys could still get them. If you have any tips and tricks that have helped you prevent UTIs, please leave them in the comments below. Also, subscribe to the channel for more videos just like these. I'd love to have you guys on board, and as always, see you on the next one.